You are listening to the Sue Ann Half-Hourish Show.
Oh, yeah.
And we're in the room.
Are we going? Are we recording? Anne!
Yes.
Yes, you're Anne. I'm Sue.
That's the point.
That's a good start, isn't it?
Correct.
That's the medicine. It's the medication.
Yeah.
So here we are. We said we would never work together again, but you begged me, and I said yes. I think I was drunk,
And you must still be.
and I must still be. How are you doing? What's going on?
I'm great. I'm just back from looking after my mum.
Oh, how is your mum?
Well, my mum is 92.
That is unbelievable.
Yeah, and she fell.
Oh.
I broke her wrist.
Oh.
So it was over with her. Carers coming in, and a flat is tiny, so like one day the carers can let themselves in, so I hear him letting himself in, and I'm coming out of the bathroom in a towel, and then he walks in and I walk out the bathroom, the two are like, ah! And they went, I said, I'm not the lady you're supposed to be looking after. And he went, oh, I thought it was a Christmas miracle.
And then your towel fell down, and he went, oh, jeez.
Oh, you do need some help, love.
But your mum is just, for anyone listening, your mum is just amazing. She is so sharp.
Yeah.
She's incredible for her age.
Yeah.
I mean, her mobility's going, you were saying.
Her mobility has gone. Do you know what I compare it to? I really know with my sister's little dog. He's now... No, but he has educated me in the way of mammal ages, which is slowly and fall off the cliff.
Yeah.
You know, the mobility just suddenly seems to go, and my mum is at that stage. So she was absolutely determined. This is how she broke her wrist. She was determined to put out the rubbish, and her neighbours have said, we'll help you with that. And she went, well, so I had the bag on her little wheelie trolley that she has. It's kind of like a little Zimmer frame trolley that she goes around the house with all her stuff on.
Aww. That's
how she gets around the house. She has a little cup of tea and her tissues and everything.
Cute.
I know, but she put the bag of rubbish on her wheelie trolley, and she went, so I had the bag of rubbish on the wheelie trolley, and then the bin's just outside in a little alcove. And so she picked up the bin, and she picked up the bag, and it missed the bin, and it dragged it, and she fell.
No.
Yeah.
Oh. And how is she now?
My mum is great, because any situation she's in, she takes it as an opportunity to have a chat. So, like when I called my cousin and said, how is she? She went, oh, she's all right. She's sitting there in A&E asking everybody about what they think of Emmerdale. And the storylines, don't you think the storylines have gone ridiculous? She loves Emmerdale. It's like, stop! Oh, Emmerdale's on, I've missed Emmerdale. And then she puts it on and she just continues doing other stuff. Like you buy her a book and she's like, oh, Emmerdale. She's amazing. She is.
And she loves reading. She's an avid reader.
Yeah, she's an
I mean, her brain is just, there's a woman near me and she lives near me. She's 96.
Yeah.
And the same, I mean, just so funny, so sharp. I go in and visit her, and the brilliant thing is that she doesn't drink.
Yeah.
She never drank her whole life.
Maybe that. Yes, my mum never drank either.
That's why we're going.
Maybe a baby
senile,
shower. Yeah.
and then they're fine.
The drink my mother would have, you think back to the 60s, 70s, if they went out, was a baby sham.
Yeah.
Which was like a mini of Sparkling Perry.
Yeah.
I mean, can you imagine now going, oh yeah,
just the one.
Yeah, just the one, a baby sham. And it's like, what, about 50 mil, 75 mil?
Yeah. That's why their brains weren't eroding. They were keeping their
so they're all low,
fine.
Yeah.
But she never drank, and I go in and she goes, oh, come into she's loads of drink in her house. From years, they're like 35-year-old bottles of stuff. And she just,
seriously,
yeah, and she just goes, come in here to the drinks cabinet. I don't know what that is. Do you want some of that? And she pours me these big tumblers of weird hooch.
What was popular back then.
And she went, I don't know the difference between gin and
Eggnog,
Cinzano
yeah.
and eggnog. And
Yeah.
I think there's an old bottle of Harp there. And she's opening all this weird drink for me. And then I listen to her, but she's an amazing life and she looks fantastic. And she was telling me the other day that she went on an old folks trip.
Yeah.
They had these little trips and she went up the north. And she said, and I went, Frances, how did you get on? And she said, oh, we had a wonderful time, Sue. We had a wonderful time. And she said, but there's just this one lady and there's a bit of a vibe. I don't know where it's coming from. She said, but I think I figured it out. Oh, I just get a vibe from her. I don't know. You know that feeling. And she kind of has it in for me. And I don't know. Everyone's very friendly except for her. But she said, what it is, she said, I have 31 dresses. In my wardrobe. Now, I didn't buy them myself. My sisters bought them for me, and they're beautiful. They're beautiful, and I like to look well, as you know. I like to look well, and I came down every night in a different dress for dinner, and it's just pure and utter jealousy. Isn't that sad? I feel sorry for the woman. I feel sorry for her, so I do. 31 dresses. Oh, and her face is like, her skin is like milk.
Yeah, my mum, that's another thing. My mum has absolutely beautiful skin. And she always looked after it. She always had her creams in it. My mum was an Avon lady.
That's right.
And the Avon creams are actually very good.
Oh.
And she has a routine every night. And her nails. And so, like, she's got a hand in a cast. She's going, Anne, can you file my nails for me? And I was there filing the nails going, oh my, she has such elegant nails. They're so well looked after. Can you just keep the shape there?
Oh, she's amazing.
Yeah.
I have, as you well know, my Nolene. So she's my step-grandmother. Which is, people have to think twice about it. But anyway, she married my grandmother and she...
Your grandfather.
My grandfather.
Tell us about that.
Gay marriage came in.
Oh, it was shocking back in the day. They were the first. Not only was she half her age, they came out. Oh yeah, no, but she was half his age. So I think she was like 35 and he was 60. So that's why she's still alive, if you know what I mean. But we're kind of falling in. She's 87 now, so myself and my sister have kind of fallen into this. Her carers kind of, she doesn't really have many people, but she is, she won't be listening. God, it's so trying. It's really difficult, really difficult. She sends us out for shopping, and it's such a long list. I mean, the list goes on and on and on, and then you get another WhatsApp message. And don't forget the onion, but it has to be a white onion. You'll get them over on aisle 6 on the right-hand side. If you have any trouble, talk to Tommy. And Tommy sometimes has the white onion in the back, because I don't like the brown onion or the red onion. As you well know, please don't let him. Now, Tommy's the only one who knows what there are. They don't have any white. Oh, Anne, it is horrific. You're going around, I mean, you need 2 days of rest after it. And then I come back with all this shopping, so much stuff. And she'll look around, she pretends to be doddery, but she's not. And she'll look around at all the groceries and she'll go, oh, you forgot the cottage cheese.
I have the same thing shopping for my mum. So Nolan can't go out anymore.
She doesn't go out anymore. She fell, but unfortunately it was a very bad fall. And it really knocked her confidence. And then COVID, the timing of COVID, she was about 82 and she'd actually 2 falls and she suffers from anxiety and now she doesn't go out at all. So she's a very cozy apartment. She's still living on her own. She's got HSE coming in twice a day. But it's very tough.
Yes, my mum was able to go to Morrison's in a taxi and go around the supermarket on her own a couple of years ago, but then that went, so she can't. So then I go to Morrison's for it, and then I don't know, do you know Morrison's in Redditch?
I do.
It's absolutely massive, and there's so many aisles, and by the time I go, they've always changed things around, and I take hours. She's going, where were you? It takes me so long getting the right thing, and it has to be the
whole thing is such a production. You have to take the whole day off.
Yeah.
Is your mum like that?
She likes you can understand it. They like what they like, and then it's frustrating when you lose your mobility and you want things to...
It is frustrating, but then I was in the big Tesco And she only likes a certain type of pasta sauce. It's the
Yes.
Diceco. The Diceco. And I'm going, they don't have the Diceco. They don't have the... Oh, could they always have it? They definitely have it. Will you talk to Tommy? Is Tommy there?
Tommy.
And I'm there like this going, oh,
I know.
please, somebody help me. Would the Super Value one not do? No, would the Tesco? Oh, no, it's just none. And you just feel like you feel like you're getting a brain tumour.
Yeah. And my mum used to love her trips too, no more than your neighbour. She loved going on her coach trips, but all the ladies that she used to go with are dead. I mean, that's the thing about getting on. And then now she couldn't get on a coach trip. But my mum used to love going to Llandudno.
Oh, yes.
Have you ever been?
I've been. Yeah, I've been to Wales. My father used to love Wales.
Oh.
Pwllheli was the other place I was in, yeah, where all those places. You can't, well, you don't like it.
No, I don't want to be anti-Wales or anti-Llandudno, but it's a bit grim.
Okay, you have to stop going in December. You need to go.
No, height to summer.
Oh, it's in. Oh, right. Okay. No, I was in Pwllheli,
Yeah.
and it was lovely. Real seaside town. Really
Yeah.
nice.
Yeah.
No, I love Wales. Love Wales.
Oh dear, yeah.
Oh, it's
no,
beautiful.
it's just there's something about it's just so past its peak. Llandudno, because there's so many old grand hotels there. You can see when it was at its Victorian peak, and they're kind of all the wrong side of.
We'll have lots of people now phoning in,
what?
emailing in, going, "What is wrong with Llandudno? I don't like your podcast." I can't do the Welsh accent. It's so hard.
I know it goes into
I have to be-
it goes. I can't do an accent anyway, but it goes.
Oh, I'm trying to do Tom Jones. Tom Jones.
Or Clarice Matthews, I can't even say her name. What was her song? Road Rage. I'm going to just say the last time we were there, and me and Mum got in a taxi, and we were just talking. He was going, "No, we have A-listers here. Gary Barlow has a big house up the road." Gary Barlow. So I went, oh, wow. Well, there you go. Llandudno, home of Gary Barlow.
I had to go for one of those oscopies.
Oh,
where I was sick, where Anna always says we're in Sniper Alley.
Yeah. What is
find?
Sniper Alley? Sniper Alley, they say, is 40s, 50s, and then you're through Sniper Alley.
I think it's 50 to 60, I heard. Well, I don't know exactly, but yeah.
50 to 60.
It's 50 to 60 thereabouts.
What is the thing about Sniper Alley? Is that way, if you're going to go relatively young, it's going to catch you then? Is that
it? It doesn't quite, and then once you hit 60, you're fine.
You're fine till you're
Which doesn't make any sense. None of it makes sense.
Or you're fucked until you hit 90.
Yeah, exactly. So you kind of go, because my mum was diagnosed at 56, so I always think just all of us in the family are get past 56 for some reason. But don't you find you're getting letters for things? Yeah. Oh, oscopies and smears and everything.
I got a phone call going, "There's been a cancellation coming for your mammogram." And then I went, oh, okay. And then it was only when I was in, I went, hang on, I only had a mammogram 2 months ago. And then I went, it's Tuesday. I usually go on a Friday. And I gradually went, oh, I've been called back. And but
I know, suddenly it's like...
Here's the funny bit.
No, and then they're just doing, I'm just going to take another image there, another image, load, and now you have to go in for your scan. But it's so funny because I've been through it, I've had double checkups so many times. I was so glad I didn't get that it was a callback to check up because they saw something. But they're so brilliant in James's. The scan looked a bit different. So then she went, we just brought you in again because
they are brilliant. But then you start, you go in to the GP and go, and I've been just feeling a little bit of a pain here. And that then turns into, do you know what I mean? Like 2 weeks to live. That basically it's from there, and then you go, oh, we better get the little scan done for that, and then the scan comes. Well, that's okay, but you know what? We'll get the oscopy, whatever it's called, Anyway, and at this stage, you're dead. You know what I mean? In my head, I'm actually.
Oh, really? Were you? Because
Yeah,
you had the.
I had the thing down. He was absolutely St James's again,
And the most amazing hospital.
amazing hospital, and he was so nice. But it was so funny. He was going, and now I'm going to put the wire up your nose. And I said, "Oh, I think there's been a mistake. There's nothing wrong with my nose." I actually said that to him. And he was going, no, we have to put it up your nose. Then it goes down your throat. Oh, I see. Sorry about that, yeah. But then they shoot this really disgusting anaesthetic up your nose, and that's very uncomfortable. It's disgusting. It's.
But then did you feel the thing going?
It was a very good anaesthetic.
Yeah.
I was going, new anaesthetic.
Are you like that?
Powerful. I was just.
Are you like this? That you have to keep chatting. I feel an obligation to keep chatting. I did that in the dentist once, and I then bit her finger off.
Oh no.
She was doing something. I feel this obligation to
Talk.
and
Why? He didn't need to talk. He was perfectly comfortable with the silences. I was doing the same. I was going, where are you from? He was going, born and bred in Sri Lanka. I was going, that's interesting. Your name is Dr. Kavanagh. And then,
Did you not be afraid you put them off? Like, they're shoving something up your arse and you're going, so tell us about yourself.
how did you get into anal stuff? What attracted you to anal medicine?
Is this what one of your hobbies just went off in the right direction for you?
oh, stop. The whole thing was so bizarre.
Yeah.
And then they take a little film of your throat, and then they can play it back to you. It's like, Sue's throat, little mini movie of going, you see, nothing. And he was going, I'm sensing anxiety. And I was going, yeah, no, I've been through a bit of a traumatic time. This is also paining me here. Well, you have a feel of my neck. And then I was going, and I also have a bit of tinnitus. And he was going, this is all stress. It's all stress. And then he started saying, but you are not alone. You are not alone. Anything I said, you are not alone.
I would have been in floods if you have somebody acknowledge that, because sometimes a consultant, was he a consultant?
I don't know who he was. His name was Dr. Kavanagh. He was from Sri Lanka, and he looked at people's throats. That's all I know.
It's because sometimes when you go for a scan, if it's a technician doing it, it's so tempting to say, "Do you see something there?" But I never ask because they're not allowed to say anything. But a doctor can tell you.
Well, I thought he was the most truthful doctor, because he said, I said to him, I started suffering from tinnitus, and then I was going, tinnitus or tinnitus?
Tinnitus. You say tinnitus. I say tinnitus.
Yeah.
They say.
But he was going, again, stress. But I mean, I was thinking, God, if I went in going, I have a big lump here.
Stress.
Oh, stress. You're not alone. Yes, but it's oozing pus. No, you're not alone. But he kept saying you're not alone, but he didn't follow up on that, you're not alone. Do you know what I mean? I was going, what? Are you free after your shift? Do you want to go for a coffee?
Was he saying other people are stressed? Or was he going, you're not? Or was he saying he was, oh my God. So what? What did he say?
No, he was going, everybody's stressed out of their bin. It's fine.
Well, I went to a new dentist. I had the most amazing dentist.
Yeah.
And Niall, and he retired, and he was just the most down-to-earth guy. And so I went to a new guy, and all I wanted to find out was whether or not I wanted a filling, and it was my first time, whether or not I needed a filling, and it was my first time going to his surgery. And I didn't know what to expect. And he ended up taking 4 x-rays. Then he put them up. It was very high tech, put them up. And then he just spent ages talking through my teeth. And
He was talking through his teeth.
She got a lecture on her mouth.
I got a whole lecture on, because I'm missing 3 teeth, but Niall used to say to me, you're grand. And that's what I want to hear.
We'll find them one day. And
That's
But he
hilarious.
was going, no, I think it was just stacking up. He was going, I think you need implants to secure your mouth. And then he started poking around and he went, you've the beginnings of gum disease there. And then he went, so what I can do is a really deep clean because it also helps stop dementia.
you said too late.
He started throwing in like warning words, like red flags. Like I had to pay in advance for this. It was 55, the introduction. But he's chatting on. He's just sitting there chatting, and I'm going. I just thought I need a fill-in. I don't need a fill-in. You'll do it or you won't do it, and that's what Niall would be like, in out really quick.
Yeah.
And I went, when are you going to do something in my mouth? But he actually just talked through these x-rays for a whole hour and talked through all my mouth in detail. And then he went, so we'll see you back. And then he gave me a 2-page thing, and it was a breakdown of a treatment plan. It was a breakdown of it. And I went, and then he went, so just pay €100 deposit to the receptionist and set up the first one. And then I'm standing there and she's gone, so that's €100. And I went, hang on. And then I'm trying to add up and I went, is this 700? And then I looked over the next page. It was a total of €1,200 over 4 appointments.
No way.
And there was oral hygiene, 2 sessions of oral hygiene that were €300 each.
Oh, scam happening.
Well, maybe high tech for posh people. I don't know.
No, it's just, I find the whole dental thing really confusing, and I do think there's a bit of a kind of a wink, go down to your man down there and have this done, and you have to have that done. It happens.
Like children's finding dry rot in your ears.
Yeah, that's exactly it. Yeah. They go, I was in the same place and one of the dentists said to me, you'll need a root canal, you need to go down to Clonski. And I came in and this very tanned Dublin 4 man, who plays golf and goes to Marbella all the time. I know, the type.
Yeah.
Went, oh yes, there's the x-ray, that'll definitely be, you need root canal. And then I didn't have the money for it. It was £900 and I didn't have the money at the time. And I went back and I went to the other dentist and he went, oh, you don't need root canal and that at all.
That was Niall.
I'll fill it.
That was
Fill it for £50 under the table.
No, that
cash.
But Niall was just so, like, I was asking about getting my teeth straightened and he was telling me about, he said, I've been impressed with some of the work I've seen in orthodontics. I would go to them. They're much better value. And I had a root canal and it got infected and it always felt like a big lump in my mouth. I hated it and ended up having to have it pulled.
So you're not going for any of this plan?
No, I just went. No.
No.
Do you know what I say? I just went, I'm going to have to discuss this with my partner. Isn't that pathetic? Rather than just be, I was American, I go, for God's sake, I wanted a filling, I don't want this bullshit.
You talk like that, would you?
What?
Why are you order? Get over here. You and your gentle lambs.
Do you remember that old Vic Reeves show?
Yeah.
How do you say, what do they call dentists in America? And someone says orthodontist. No, dentist.
But you know what I mean? But it's so, like, I was going, okay, you go in with your guard down and you just, with medical people, I have a tendency to do the guards down. And then gradually, as this guy kept talking for an hour, and I went, when's he going to do something? If I need it clean, and I will go, I'm doing a bit of clean too.
Yeah.
But I thought, he's doing a hard sell. This is an hour-long chat. And
technically, he's not even a hygienist. A hygienist is a separate job.
Yeah.
Yeah, but can I just say, because I know the place, you get the hygiene done on your PRSI for £90.
I'm not saying it was a scam or anything. I just,
I mean, there's no need to mention.
You are,
but I love that idea. And rather than, I don't know, are you like this? I don't know what. I couldn't directly communicate what I felt like. I just explain that.
Well, you could have said, I'll think about it and I'll be back to you.
No, but instead we got.
You didn't say you needed to discuss it with someone
I
else.
was discussing with my partner. He controls my mouth.
Yes.
I just wouldn't.
He's so controlling.
He's so controlling. I just wouldn't.
We'll have no fillings in there.
But it's so dramatic.
Yeah.
I had to tell it to him that then. It's like the big beefy guy with tax comes in. Oi! What's this about fucking
Yeah, what you been saying about my partner's mouth?
Yeah, I'll give you some fucking mouth.
You're gonna need a dentist.
You're gonna be getting your own fucking wood in your own mouth.
Fill that. Yes.
I think it is an element of that. I've always liked that idea. I felt that when I was on my own in London, that there were situations where you had to let people know that there was some geezer in your corner. Do you know?
That's the name for our next book.
Geezer in your
In
corner.
the corner. I've no geezer in my corner because Sarah wouldn't really describe Bela as a geezer.
No, you have to. I mean, I know it sounds it's a jungle out there. No, in the real world with people, sometimes you have to have people know.
Isn't it great though that he thought you had that kind of money to spend on your mouth?
Well, I wouldn't mind spending it. It was just so evidently. You go to the dentist expecting maybe €80 filling and maybe €80 for a clean, and he gives you a 2-page plan, and it's well over 1,000.
No. It sounds well fucking Dutch.
It was right. Yeah, it was. So I said, I'll send him in, and they'll have a chat with you. All right.
Yeah, but the fact that I had a tanning unit off to the left should have been a sign.
They put down your lips.
Don't they do surgery in little facial things as well?
No, not there.
No.
No. Although they say dentists are good for the Botox.
Oh.
Because they know the facial muscles. That's the thing that makes.
Sorry, why do they know the facial muscles? From pulling teeth.
It's like pilots having to know the full inner ear.
Our pilot's good for Botox.
They're good for ear stuff. They can do anything on your ears because they know each little area thing in your ear.
Pilots. This is very obscure information.
So Aer Lingus or Aer Reinta? Or pilots in general?
Ryanair
It's
is
part of their. Oh,
Ryanair just do the nose.
No, they know about eyelashes and things like that. They don't know about ears. No, my brother's a trained pilot.
Yeah.
And he had to do you had to study the eardrum, the machinations of the ear.
Are you sure you was training to be a pilot?
Oh, I haven't seen him for a while actually.
Tell me why.
I don't know, I think it's to do with altitude.
All right.
And how it affects the eardrum.
But have you heard that about Botox? They say, I wouldn't let anybody near my face with a syringe unless they were a fully qualified medic, doctor, or they say dentists obviously know all this, all the musculature, sure.
Interesting. And did he have a little room off his room then? With the Botox.
And can you imagine me saying that too? No, I don't think. I'd say he's doing so well on the teeth, he doesn't need it.
He's doing so well on his plans.
Yeah. Can I tell you another thing about him?
Tell me.
I am on blood thinners.
Yeah.
So when he was poking around in my gums, finding this, the depth of gum disease involved,
Apparently.
they were bleeding.
Oh.
And his assistant never gave me, Niall always had the traditional kind of rinse thing. It was always have a rinse there, and the old.
Nothing.
I just had to go like this. And just.
Oh.
And I thought, I don't feel cared for it, but I didn't say it. This is the whole thing. It's all in my head. I should have been going, my geezer's outside, and I'm not liking this.
Yeah, if you don't give me some of that liquidy stuff
And let me have a
wash out my
spit.
mouth, have a spit, I'm going to get me geezer. Oh, listen, the whole thing is so surreal. I had to go for a breast check as well, actually. And again, like that, I was feeling all stress, feeling a pain here, and thought, oh, I'll go in. But the guy was hilarious because, first of all, he was absolutely gorgeous. I do think he was gay. I'm not sure. But he was absolutely beautiful, like a beautiful looking man. But he was like, he just prodded around and he went, very strangely, he went, I bet the pain is there. And he just went like that. And I went, ow, yeah. And he went, yeah, that's fine. He said, you've been wearing underwire bras, I imagine.
But how come the pain is there from an underwire?
It was kind of, I don't know, but it is. And I went, yes. And he went, they look good. He was going, they look good, I will say that. But no, you're going to have to switch. And I went, oh. And he went, I know, you just don't get the same shape.
But did he tell you what?
This is the conversation. I was half expecting him to go, I have my own line. What about these? What about this one? It was a hysterical conversation. I was going, no, M&S are doing, you can get a few different ones in M&S. And he was going, oh, interesting. And Fantasia do a good line in underwire bras. In non-wire.
Did he
non-wire. Yeah, Fantasia, you can get some good. This isn't James's. Honestly, the whole thing is so.
James's is so wonderful. That is treating people like human beings.
Yeah.
And they do.
Yeah.
Can I tell you the one thing?
We've just re-recorded for 2 hours, but go on.
No, I found this really interesting. You know, when I had breast cancer, I had a huge lump on my breast, but it wasn't like a lump, it was just a swelling. That's why I didn't think it was cancer, because at that time I thought cancer was a lump.
Can I just say, sorry to interrupt you, did the doctor not tell you? Did a doctor not tell you that it wasn't cancer?
This is the two things. The two things. I went to two different doctors. One, my sister made me go to an emergency doctor the weekend when I just said it to her. She went, you're going to a doctor straight away. That's not right. That doctor went, I don't think it's serious. I think it's a cyst. My own doctor said, I think it's a cyst. And the interesting thing is when I went to James's and I finally was, got to know the consultant a bit, she said, I knew from the moment I placed my hand on your breast that it was cancer. And it's interesting, isn't it? I mean, I know they specialise in it, so they just know immediately. But the disconnect is amazing because breast cancer is so common. But, I had two different GPs feeling it, going, no. And she went, as soon as I did that, I knew it was cancer. It's interesting there.
But you literally had a GP going, yeah, no.
A cyst, I think by the size of it, that it's a cyst.
That didn't send you on then?
Oh no, she did.
She did.
She did. And then what happened was I'd been sent in, so I 2 alerts went in, and then given my age and everything, they had me in very quickly. And because it was brilliant James's Hospital, you hear about some people having to wait weeks to find out. This was in 2011. I presume it's still the same, but I found out within 4 hours that I had cancer.
I know.
They're so quick. They do the whole
and then I just remember it being really quick, all your tests after that.
They were amazing.
So young.
They were amazing.
That they got you in so quickly.
Yeah.
And then I remember you coming into town and telling everyone the news, and then we all got really drunk.
In America, they're like, an alcohol scar.
Like,
I was immediately macrobiotic.
Isn't the alcohol carcinogen?
Was my first thing was me and Una went outside, we had a cry, and then Una went, what do you want to do? And I said, get drunk.
And
I got so
we went to the Mercantile and
Mercantile, cocktails, and had a laugh. Did we have a laugh? We did. We had a laugh. You have to laugh.
Tears and laughter.
There was tears and laughter, and you don't know till you've been through it, so there's no point. This is the whole thing, isn't it? You get the news and then you deal with it. Yeah. And you've had enough run-ins with cancer to know with your parents and everything. And I'm here.
We're here
with
all our teeth.
Well, you have you
on that note.
No, I'm interested. Do you have all your teeth?
I've got all my teeth, but I've got a lot of fillings. from
And
when I was a
these
kid.
are lovely.
When I was a kid.
I have really crooked teeth here, and I was saying to himself, do you think I need to get them straightened? Because
geezer.
yeah, I said to my geezer in the corner, I said, do I need to get these straight?
And I said, you don't want to look like Tom Cruise. Yeah, go for it.
No, do you know what he said? He went, no, just don't open your mouth so much. You can go to Smiles, and it will cost a few thousand. I think it's worth, look. Go on.
We better get some listeners.
This better work.
Yeah,
We
this
better be
better
funny.
work.
Come on, be funny.
I would not go to any company called Smiles for anything.
No, but it was Niall who said to me,
Yeah.
you know, they're not, I have bad. I feel like Niall was my geezer in my mouth.
Niall was your geezer, and Niall was also my geezer too.
Yeah, you need
I loved Niall.
yeah, I like when you're dealing with a man who is solid.
He's a solid man, and he wasn't a money chaser.
No.
And he, I'd like to dedicate this podcast to Niall McDonough, the dentist.
Oh, he was amazing.
Yeah.
And I liked his moustache.
Yeah. And I like
I was going to for ages and I didn't even realise he had one because he always had his cover up over his mouth.
Yeah.
I don't know, because he looked like...
He was like an uncle, like a really caring uncle.
Yeah, and also I had to have some teeth pulled, and he was so strong. You know, I've had a tooth pulled by a lady dentist, and it's like...
Yeah.
And he just went, oh, it's out.
Yeah. He's strong, he's caring.
And he's retired.
He's fucking retired, unfortunately, but anyway.
So I'll give it a question for both of you.
Yeah.
So what can people expect from a podcast with Sue and Anne?
Well, lots of medical detail.
Lots of
Is this going to be an ongoing thing of a dental examinations?
Yes, because that's what you do at our age. You talk about your ailments. It's a compulsory part of the conversation. Anytime you meet for a drink or a cup of tea, that always has to be
What's fallen off today?
What's falling out?
my frozen shoulder, my tinnitus arteritis.
Do I smell wee? Oh.
Incontinence is a regular one then, is it?
Yeah.
Yeah.
So, well, we'll try and keep it to a minimum.
That's
Because my knee is very stiff.
Oh, my knees have got sore again.
Yeah.
And you've been sitting in those chairs for over half an hour now. You must be...
I am impressed. Niamh Kavanagh is doing Dancing with the Stars. And I'm, you know...
She's good. I worked with Niamh. She doesn't drink either, by the way.
So, yeah. So,
she's good. She's good. She's healthy and fit. Well done.
Yeah.
Brilliant.
So do you guys want to say goodbye now and tell us when the next one is going to be?
Oh, that was our pilot.
So that was our pilot, and we got a lot off our chest about...
Yes.
So it's more stuff about geezers and why you need a geezer.
Yeah.
And, and...
And just more stuff.
More stuff.
Yeah.
I mean, there's so much stuff.
There's so much
And
stuff.
Emmerdale is a way of life.
Emmerdale.
And thank you. And we're out.
That's Corey. Brought to you by Sue Collins and Anne Gildea. Producer Paul Farron.